Hello, welcome to Pharmacology. This is session 2B, and we are going to talk about nursing management in pharmacology. This is a video created by the pharmacology team for ATP 2025. The learning objectives that we have in session 2B, 3A, and 3B are the role and responsibility of nurses related to medication administration concept in safety and nursing process, the concept of 6 rights, and also the role of nurses for handling patient compliance with treatment. And in week 3B, 3A, we are going to learn about enteral and topical parenteral administration method with the steps in nursing process for administering medication, as well as in week 3B, we're going to learn about drug calculation and reporting process for medication error, as well as strategic steps for nurses to address medication errors. Let's begin with session 2B. So we learn about role and responsibility of nurses, medication administration concept, and also the concept of 6 rights in patient safety and the role of nurses to help with patient compliance to the treatment. So, what are the nurses' responsibility and roles? As you can see, nursing is a unique and complex science where in medication administration, nurses have the roles to provide prescribed drug therapy. So the medical professional or the doctors, they will be then prescribing a medicine, and then we will then provide that prescribed drugs therapy. And then we have the roles of teaching education patients to adhere to the therapy um, and to ensure that the desired outcome can be achieved, as well as to evaluate the effectiveness of the therapy. In patient safety, for drug administration, we need to understand that patient safety is the absence of presentable harm to patients and the reductions of the risk of unnecessary harm associated with healthcare to an acceptable minimum. And it requires extensive knowledge in the basic sciences such as anatomy, physiology, nutrition, biochemistry, and pharmacology, as well as social sciences for sociology and psychology, and education as well, and other disciplines that is necessary for drug administration. So to administer medication safely, the nurse need the basic mathematical skill because we need to calculate the dosage of the medications that we are going to give. Um, Safety in drugs or in medications is also one of the goals in International Patient Safety Goal. It's you can go to the jointcommission.org and you'll see the IPSG, and one of it is that to improve the safety of medications. This is the IPSG number 3, and here is talking about the high alert medication, look alike and sound alike drugs, as well as the high concentrated electrolyte. So in high alert medications such as insulin, opioids, chemotherapy agents, antithrombotic agents, anticoagulants, thrombolytics, drug with a narrow therapeutic range or like digitalis, and neuromuscular blocking agents and epidural intrathecal medication, these medications are labeled high alert like this one, and it's then stored in a separate enclosed container. And this can cause a fatal um, effect to the patients if we are not using it properly. And if it's like a little mistake, you can do a very serious risk. And there are the list of the medication that they need to create, the hospital created every year. So you don't know what to do. And the hospital, when they created this, they will then also provide with the how to administer the medication, such as with the using the bolus or like this, and not just a syringe or any other thing. And the second one is about look alike and sound alike. So there are medication that has the same name, like similarly and packaged the same. Like for this one is ceftriaxone, and you have also cefotaxime here. So it's actually two different medication, but they have the same, like almost exactly the same um, look. So you have to really avoiding storing the look alike and sound alike drugs in the same place. Or you can also have a Tolman lettering, like instead of having the same capital, you have just this one, dopamine and dobutamine, so that it's easy to then recognizing that it's two different things. Okay, and next one is we provide also list of the drugs that looks alike and sound alike in the hospital. The next one is high concentrated electrolyte. So high concentrated electrolytes such as potassium chloride, potassium phosphate, sodium chloride, magnesium sulfate, they are very risky when we use it without like when you are just using it without care, because it can cause many harm to the patient. But it's also useful, but you have to use it like accordingly. And this medication, for example, the NGSO4, it's for delivery room for preeclampsia, so you have to have this one dripping. But then this is also needs to be very careful, because it can cause like a problem on your vein. So we will have like burning because it's like too strong, and that's why you have to like really making sure that they are being administered nicely and rightly. So this medication, if it's a high concentrated electrolyte, they don't provide it within the inpatient ward or inpatient care, but they have this in an emergency trolley, or you can request for this, and then you have to be able to handle it with the trained staff. And yeah, you need to just separate it from the other medication. Now move on to the nursing process. So in the nursing process, we understand that in relation to medical therapy, the use of nursing process ensures that the patients receive the best, most efficient, and scientifically based and holistic care. As you see, we have the nursing process here. You have the assessment, diagnosis, planning, implementation, and evaluation. So this process is like a cycle. So it goes on and on until the patient then is healed. So it moves on and on and on, so we can make sure that we reassess our patient again and again and again. Now, the key elements, as you know, we have ADPI, so we have assessment where we gather information, and then we have the nursing diagnosis where we analyze the information and then do the conclusion, and we have the nursing planning where we determine priorities, goals, outcome, and also select the intervention, and then we do the implementation or the intervention itself. So we do the action, we meet the patient needs, and then we do the medication administration, education, even comfort measures, and then we do the evaluation to determine whether the interventions have caused any impact in our patient's life, and then is that fulfilling the nursing diagnosis or the needs that the patient has. Next, we talk about drug prescription. So we receive, as nurses, we receive medication orders, and they are provided through many things, such as verbal instructions. So the doctor come, and then the doctor say, hey, can you please administer paracetamol 500 milligrams TDS? And then once you hear that one, you have to read back. You have to read the message again, talk to him, and then you have to then written it into the medication record. And this is a very easy to get mistakes, because sometimes when you're just giving a verbal instruction without a written instruction, then it's be forgotten. And then the one that is used to be used is the IMR, or the inpatient medication record. You do the handwritten. You write the medication on that paper. I think in one of your tutor you already see the IMR, so the doctor will write the prescription there. And then we have what we call now the digital medical instruction, or the EMR, or electronic medical record, where the doctor type and then the pharmacy will process, and we as nurses, we then will deliver, or we then be the one that administrating the medication. Now you have quite a few of prescription drug type. We have what we call the standing order. We have what we call the PRN, and we have the single prescription, the start order, and order now order. Now, with the prescription type of routine prescription, this is the one that the medical provider just write on the IMR. For example, this medication tetracyclines, 500 milligram orally 6 times a day, and the prescription can be discontinued as far as many days as needed. So if it's like a set of antibiotics, so it's like a broad set 1 gram IV drip once daily for 5 days. So that's like a set of treatment that is being then prescribed for the certain condition, and it can stop when it's not necessary anymore. And then you have what we call a PRN medication, or order to and from, or if necessary. So this is the doctor ordering the medication that given only when the patient need it, and using a subjective and objective assessment to the patient before giving it. For example, a patient is having a severe pain because of cancer, then we can do the PRN of morphine sulfate 2 milligram IV every 4 hours for incision pain. So if they have that PRN, it means like it's not a regular medication. It's only given when the patient is complaining of pain, unbearable pain, and then morphine kicks in. Another type of prescription is what we call one time. So this is a medication that's just given once at a specific time, such as for preoperatively or pre-diagnostically. For example, Ativan 1 milligram IV on call for MRI. So you know that MRI is a scary procedure for some people. So once they go into the tub, then they got scared, so then we give the Ativan to just relax them, to just go through the procedures. The same with prophylaxis for surgery. So before you got into the surgery, you receive like a gram of antibiotics, so that you don't build up with the um, surgery you don't have the infection after surgery. Then we have what we call the stat order. Stat order is given to a patient in an emergency situation. So when the patient has suddenly change in this condition, so then the doctor will order a stat order that will need to be administered immediately and only once. So for example, a prazoline 10 milligrams IV stat of in some cases, if the patient is having an anaphylactic shock, then we're going to have the epinephrine shot given stat like right now to the patient. Another one is what we call the now order. So it's the medication that is given and ordered just right now after the assessment, and the nurse has like 90 minutes to administer it. It can be like coming back to the standing order that you have it all, but then can only be also once given to the patient. For example, only like extra medication now given to the patient. Now, you can read this book by Potter and Perry, and you will see this explanation in the book, so you can like have a thoroughly understanding about it. Let's move on to the concept of six rights in drug administration. Like most books now, we have what we call the six rights in drug administration. So it's the right dose or medication, right drugs or medication, right dosage, right patient, route, time, documentation. Then some books, they also have the right indication, and some book also they deleted the documentation, but they changed with right indication. So it depends on which facility, but then you have to know that this is like the rights, six rights of the drug administration. Now let's talk about it one by one. So right drugs is that we nurses, we ensure that we are given the correct medication. So we compare the medicine with the order, and then we compare the label with the EMR at least 3 times. And then you check the name, you check the name of the drugs, check the name of the patient, and you don't administer when you don't see the medication itself. And then you compare with the label, and then you do the double check with another nurse to make sure that you're giving the right medication to the right patient. And then you verify the medication name before the EMR. And then as you be at the patient's bedside, you check it again. Then you see that the medication is there, the label is there, and then you're not giving medication deliberately to a person. Like for example, I'm the one that preparing it. I cannot give it to you for you to administer it to the patient. So if I prepare it, I'm the one that giving it to the patient. And then you have to know the nursing practice standard. You ensure that you have the correct dose, correct time, and then the correct patient. Now with the dose, you have the system that actually already being done because there's so much error. Like for example, a single dose package is like one package of the drugs already being put together for one go. So then you have the standard measurements such as cup, syringe, pipette to like very make sure that you have the accurate dose, and you have to double check with another nurse, and then you have to make sure that you calculate the dose correctly. Then as you prepare, you be aware of any special preparation required. For example, like the oral medication needs to be shaken, parenteral medication needs to be diluted with specific solution, and also what is to do with the medical topical medications administration, such as you have to wear gloves or you have to do shaving before you apply it into certain areas. And then this is the abbreviation, the meaning, and then the correction, how you use it. So you have like the TBSP or tablespoon or mils, the 1 teaspoon TSP, and then it's 1 cth is cochlear T is like 5 mils, and you have 1 oz, and you have GTT, and then you have unit, and then you have the international unit as well. So now you see here we have like different type of the same drugs. So they have the Tempra drops, you have the Tempra syrup, you have like the bigger one, the smaller one, and then you have here the tablet as well, 503 to 5. Here also example of the syrup. Now with the right patient, medication error happen when a patient receives medication intended for another patient. So in the International Patient Safety Goal number 1, we talk about the use at least 2 patient identifiers when administering medication, which is the patient name and the medical record number, or even the date of birth, or even with the barcode, or even by the number of national identification number of the patient. And then do not use the room number or neonatal incubator name or the patient's location, and you have to ask the patient to state their full name and their date of birth at least. So if a patient in a coma, you double check with the nurse or other medical professional. If the patient has no identification, then you have to give identifier Miss X or Mr. X, and then if the newborn there as the one that received the medication, you have to see that the newborn will then be using the bracelet with their mother's name on it. Now with the right route, you always consult a healthcare professional if a prescription do not specify a route of administration. And if you're going to prepare oral medication, do not use syringes, use dropper, medicine cup, or enteral a needle to just avoid medication error. And there are a lot types of route of administration: IV, IM, SCP, OPR, and TP, and you have like the how to do it, inhalation, intraperitoneal, intraurethral, intrarectal, intravaginal, intraocular, nasal, intraarticular, intrathecal, epidural, intraarterial, intracardiac, intraosseous, intrapleural, intravesical, then intrauterine. And then you have also the membrane mucosa by sublingually or buccally. And then here also the where to put, sometimes they also put the location, like for example AD is right ear, OD is right eye. So you have the oculus and you have the oculus and also you have the iris. So it's the ear, and then sometimes you have like PO, or it's just basically means like orally given. And if you see why it's like different, it's because we have the um, and then now we move on to the right time. So the right time means the term frequently used in the time for drug administration. So you have D, H, P or PC, A, C, and then every with Q and QD, every daily QH, every hour Q1H, every 1 hour Q2H, every 2 hour QAM, QPM, OD, BD, TDS, TID, QDS, QHS, and ATC. And then you have the STAT or ad lim, like as much as desired, and PRN or Pruronata is needed, and QZ as much as suffices. Now we talk about the right documentation. So you have to ensure that the medication that is being given clearly include the patient's name of the medication, how it was administered, and then the dose, the route, and the frequency, as well as the time when it's being given to the patient. And physician, they are responsible to provide the understandable prescription, but then after that, you also have to document it, like what you have given to the patient on the medication administration record. And you cannot document the medication that is not administered, and you have to document after you administered the medication to the patient. And you have to provide the medication name, the injection shot site or the route, and also the patient's response after given medication. So we've done talking about the right 6 rights, but I'm going to talk extra about the right indication. So this is an extra thing. So it's according to the Institute for Safe Medication Practices. You have the 7 right medication administration, which is the right indication to really enhance the safety of every medication. It's indication-based prescribing. We narrow the medication choices, dosage form, and dosage regimens, and we reduce the risks for wrong medication being chosen. In addition, when we are prescribing medicine with the right indication base, we educate the patient and can improve the adherence of the medication. And communications always important in the intra-professional team and family and caregivers. So we have to always communicate about what's the indication, and also we hope that medication reconciliation also improve, because indication-based prescribing aids in preventing represcribing. So we really make sure what's the indication so that we can give like the right medication without a double dose of medication. Now, what are the roles of the nurses related to the treatment with patient compliance? We need to make sure that the patient understand that OTC can impact effects of medication, or OTC, alcohol, nicotine, alternative therapy, and caffeine. It can have impact, or it can give effect to the use of medication. And then sometimes patients, they are failed to mention to us what the OTC medication or alternative therapy that they are using, and they then dismiss the real medication. And then you can ask also about the OTC medication to the patient, so then we really know what are they doing with their health. And then sometimes patient also forget to use their prescription that they regularly take, such as the oral contraceptive, because they consider that that's their routine, and you don't think about it very much, because it's just it. Alright, so these are the references, and please feel feel free to have the reading assignment for your class from this book in Unit 11, Unit 2, the Safety Drug Administration Drug Levels. And then also in this book, please take a look on the Unit 8 for medication so that you will understand more about how to administer medication. And thank you for attention.